My name's Matt Bartlett. My typical working week's divided between patient-facing vascular diagnostics, research and teaching and lecturing on ultrasound physics. I first started using the Aplio ultrasound systems when they were still branded as Toshiba, which was probably around 10 years ago. It was the first time I'd overseen procurement of new equipment, and having never used an Aplio machine, we trialled the system following recommendations from other vascular labs in the UK. I remember being immediately impressed with the general image quality and the Doppler sensitivity, but the thing that really made the system stand out from the crowd was the level of operator control available, which allowed the image to be quickly optimized whilst remaining very intuitive and easy to use. This level of operator control, combined with the knowledge of the application specialists, meant that we very quickly had a system which felt as though it was designed specifically for vascular work and fine-tuned to our department protocols. We currently have the Canon i800 in our department, alongside ultrasound systems from 2 other manufacturers. As part of a large teaching hospital, I feel it's important that the trainees have access to a range of different equipment, but the Canon remains my first choice of machine for clinical work, especially for more complex scans like surveillance of fenestrated EVAR stent grafts or assessments of congenital vascular malformations. The most important aspect of any ultrasound system for me is the level of trust you have in its ability to identify relevant pathology and the confidence this gives you in knowing that you've offered your patients the best possible service. The level of control that the iseries hands to the operator definitely instills this confidence, as the artifacts, limitations which are inherent to ultrasound can be kept to a minimum at all times. So another huge advantage of the iseries is the user-friendly workflow. Despite the complexity of the functionality available, the combination of the sub-preset menu and the ability to sort of reassign the functions of most of the hardware controls means that the system can be configured in a way that retains a level of simplicity and usability. This is also why the systems feel like they've been designed specifically for our needs. It feels like a vascular machine rather than a general ultrasound machine which can do vascular imaging. The i800 is also my go-to machine for teaching, and this is largely due to the same reasons that it excels in the clinical work. In recent years, many of the other popular ultrasound systems seem to have reduced access to certain imaging parameters or hidden them away behind menus. The level of control the iseries machine offer allows students to experiment and learn how different parameters impact the way their image is formed and displayed. I always tell my students that learning ultrasound physics from a book will take you 3 times longer than sitting at a machine and thinking about how and why each control does what it does. And the i800 is perfect for this, as it allows students to dive into many of the kind of more subtle and maybe lesser used functions, whilst remaining intuitive enough not to be overwhelming. The biggest challenge in our clinical practice is trying to confidently image heavily calcified arteries. We see high prevalence of diabetes and renal disease, both of which can result in severe lower limb artery disease. The i800 offers excellent Doppler sensitivity with minimal degradation of the B mode image in duplex mode. And the confidence that we have in our scans, even in the very challenging group of patients, has meant that the use of CTA as a secondary imaging modality prior to angioplasty has been dramatically reduced over the past few years, and the majority of our patients are now being treated solely on the basis of their duplex scan. I regularly recommend the iseries machines to colleagues from other hospitals and trusts, for all the reasons I've just talked about. I have nothing but praise for the application specialists and support staff who genuinely understand what the systems are capable of and how to optimize them for our needs. We appreciate vascular is a relatively small specialty and probably not the first to be considered when a new machine's being developed. And despite this, the team at Canon are continuously asking for our feedback, and with each iteration of the machine we see our suggestions being implemented and we feel listened to as a profession.